right-wing Tea Party Republican, he has decided to make the implementation of the insurance exchange that much more difficult for Georgians. Call your insurance commissioner. Tell him that you want quality insurance. Tell him that you want real choices about how much that insurance will cost you and your family. Tell him that he works for you. He does not work for the insurance companies that fund his campaign. And before you're done, remind the governor that many of his Republican colleagues across the country, including Jan Brewer in Arizona, have seen the light on Medicaid expansion. Even Jan Brewer found a way to work with her Democratic legislature because she understood the millions of Latinos in her state and other uninsured Americans in Arizona stood to benefit. Remind the governor that he should not be concerned about a Tea Party challenge to his primary re-election, but he should be concerned with getting Georgia that much stronger economically, that much stronger on a health scale, and bringing us the affordable care that we deserve. Thank you.
Thank you, Erica, so much for your words. And she's right. The insurance commissioner was elected to make sure our insurance premiums, our meaning consumers, are affordable and not to be in the pockets of the insurance companies. Next, I'm going to bring up someone who really needs no introduction, and that's Georgia Senator Nan Orrock, who has been a passionate advocate for health care reform, and we are so honored that you could be here today and light us up a little bit about that passion that you have about health care reform.
Thank you so much. Thanks to all of you who are here because you care, because you know, and because you want to be a messenger on the Affordable Care Act. You want to help be part of the voices that counter the lies, that counter the myths, that tell the truth, and that turn on Georgians to what a great, great benefit the Affordable Care Act provides. We lovingly call it Obamacare because we believe that the struggle to pass this massive health reform bill shows that President Obama does care. We know very well, more than half the bankruptcies in this country have come because families simply could not bear the burden of a health crisis and the enormous cost on a family pocketbook. Costs that are unspeakable and unpayable for an average middle class or working class or poor American. So the president set out to correct and right the wrongs and move us closer to the day when all Americans have a right to health care. You know, the rest of the world has kind of figured this out. All the other Western civilized, the advanced nations in Western Europe and here, Canada, look to the north, look to the south, look to the east, look to the west, they figured out how to have universal health care. They figured out that the health care is a right. And so we're stepping down that road under the leadership of this president to address the massive number of uninsured people in this country, and certainly here in Georgia, as well as to have a much more reasonable health care market for those who do enjoy some health care coverage. I want to talk for a minute today and turn the spotlight on how much it means to the women of our state and of our nation to have health reform, to have the Affordable Care Act. We're going to be providing preventative services, health services for women. That's preconception, that's neonatal, that's the kinds of annual screenings for HPV, the virus that leads to cervical cancer. We see women across this state and across this nation lacking access or having to pay enormous out-of-pocket costs for preventive health care for women's health. And we know when the women are healthy, they give birth to healthy children. All right, they raise healthy families. And we know that women, over and over, we've seen it, they make the health care decisions for their families most of the time. We're the ones nudging that guy to go get that prostate checkup, aren't we? we're the ones managing our children's health and dental care. So women have a tremendous amount to gain as the member of the family that really kind of drives the health care decisions. And when mama's happy, everybody's happy.
Amen.
I believe the president said that to Michelle one time, didn't he? He said, when mama's happy, everybody's happy. So we say the Obamacare, you know, is a policy that's going to make mama happy. I'm talking to grandmama,
Right.
sister-in-law, daughter, auntie. We have much to gain by opening the door to a basic, fundamental, common sense, smart, and dollar-wise approach to healthcare, and that's what get people checkups. Let's find this stuff before it gets bad. Let's get people access to medical care and to dietary advice, nutrition advice, lactation advice, how to nurse a child. We need to pick that up, you know, all across the country of infants being able to get mama's milk. And we have Obamacare is a policy that puts those services out there where women have access to them. Now, we've got a couple of issues here in Georgia, don't we? We gathered here today. We heard an eloquent exposition of that from our last speaker. But we've got a state insurance commissioner that seems like he wants to do more complaining than commissioning.
All right.
All right? And issuing press releases and hooping and hollering about how we're going to run everybody out of the state with our expensive health insurance policies. Well, when you peel that back, you found out, you know what, that really wasn't the case. When he was asked about California and Oregon and other states, New York, showing that when they go to the insurance exchange, the marketplace for health insurance, that actually the costs are going down, not up. And he just simply dismissed that by saying, well, that's not true. Well, you know, let's stick with the facts, Mr. Commissioner.
All right.
So we need to have the insurance commissioner doing the job that we elect an insurance commissioner to do, and that's to rein in healthcare costs. Number two, the governor needs to hear loud and clear that Georgia cannot afford to miss out on the Medicaid dollars that come with Medicaid expansion. Now, I talk to legislators all over the country, and they're quite proud in the state of Washington or in the state of Illinois. I could rattle off state after state Iowa, where they've carefully crafted an approach that expands their Medicaid coverage. And if we did that here in Georgia, do you know that that would bring in billions and billions and billions of federal dollars? It would mean mama could sleep better at night, right? Because got access to health insurance. It would mean our economy looks better, our healthcare providers, our healthcare infrastructure benefits from these dollars being in the health economy. You don't have to be a doggone economist to know that when you spend more money in an economy, you have a more healthier economy. And the Obamacare brings in to the state to cover the additional people on Medicaid that need and deserve to be covered.
All right.
And they'll be left out in the cold otherwise.
All right.
It brings federal dollars in the billions. And the studies that the experts at Georgia State University have shown us is it would create 77,000 new jobs here in Georgia over the next 10 years. What's wrong with that? That keeps mama happy and papa too, doesn't it? And these young people coming out of school that need a job. So Obamacare is a win-win, and we need in Georgia to step up to the plate like they've done in all kinds of states that have Republican governors. Arizona, Nevada, New Mexico, North Dakota, Ohio, the list goes on and on. Florida, they are expanding their Medicaid coverage. And they're doing it because it makes good sense. It's good for the health of the people in the state, and it's good for the economy of the state. And to fail to do so in Georgia, we're slamming the door on 25,000 veterans
Right.
Men and women. When we don't expand Medicaid, that coverage would go to 25,000 veterans that don't have health care coverage now. Shame, shame. And I'll tell you what, all the numbers agree. Over 500,000 Georgians will be covered with health insurance if we step up to the plate and expand our Medicaid program. It's simple, it's smart, it's common sense, it's what the people want, it's good for our economy, it's good for our health profiles. So we really urge the governor, as well as the entire healthcare community, to step up to the plate and get on board. The train's leaving the station. And you know what? Those dollars that would come to Georgia if we expanded our Medicaid program, do you know where those dollars will go? To other states. We won't get them. They'll be in the economies of Florida, New Mexico, New York, California, Oregon, Iowa, North Dakota. Call the roll. There's a handful of hard-headed folk in a few states that are turning their back on Medicaid expansion, and we know what they're really doing is turning their back on the health needs of our people. So that's the message to take loud and clear, is that it helps women, it helps families, it helps children, it helps our economy to embrace the Obamacare program and principles. And let's get busy building a healthier Georgia. Thank you.
Thank you.